we are going to be talking about vocabulary, and in terms of research-based strategies to guide our AAC practices, we're in a little bit of a dilemma when it comes to semantic instruction. So our knowledge base for exact pathways for what it takes for somebody who has AAC needs to become linguistically competent is quite limited. We don't like to talk about this much, but we need a ton more research. We have pockets of information about things that are effective for teaching specific language skills to individuals with individuals who have complex communication needs, but there are a great many gaps, and we probably, if we're honest with ourselves, have more questions than answers. For example, we have research evidence to show the benefit of an intervention strategy with preschool children who have cerebral palsy that's effective in storybook reading, just as one example, right? Can we automatically assume that that strategy is going to be equally effective with preschool children that have autism, for example, or that these same children, it would be effective with these same children at 13? So the strategies may be equally effective, but the truth is we don't have definitive answers, right? And we just need to be honest about that. We sometimes assume that people with AAC needs, and I find this really interesting, we sometimes assume that people with AAC needs are more like each other than other groups of learners who speak, right? And so I would, this young lady that you see here, as she, I know her now as a high school student, right? She has cerebral palsy. She has good operational competence of her speech generating device, right? Her language is still very immature, right? But as a learner, is she more like a nonverbal student, another nonverbal student who has autism, or is she more like a speaking student who has specific language impairment, right? So I think when we have limited research in the particular clinical population that we are talking about, or a particular intervention tool or strategy, we have to stop and think, who are we teaching and what research should we be pulling from? And there, in the area of vocabulary, I think there's a wealth of information out there that was done with other kinds of kids that we may want to take a look at. So as all of you well know, the population of people who use AAC isn't one single population at all, right? It's many different populations with a heck of a lot of heterogeneity. But when you add in the diversity within each disorder area, it gets even more complex, right? So the age range, right? You have womb to tomb pretty much, right? It's huge, right? Cognitive abilities, wide variation, motor skills, very broad range, and so forth. So to expect to have a situation where we're going to have sufficient research on the exact kind of client that we are working with, on the exact skill that we are targeting, right? It's a pretty big gamble, right? Most of the time, that highly specific research isn't there. And if we have more time, we could talk about each of these, areas that you see here in depth. But our focus today really is on the more practical side of things, so we'll have to leave that for another time. So as interventionists, what do we do when there is not that clear pathway of research-based teaching processes and procedures and tools for the exact kind of learner that we're working with at the moment? First, we look to the literature that is there, right, and make informed decisions about how to apply it. In AAC, that often means that, There we go. So in AAC, that often means that we're extrapolating from research with other kinds of learners or other kinds of skills. And when we do that, it helps to really carefully consider those similarities and differences between our target learner, right, and the kinds of individuals that participated in that research. What we know about the language learning experiences of children who use AAC is that in addition to the conditions that led to their need for AAC, that children who use aided AAC learn language in conditions that are vastly different from typical development. So my friend and colleague, Gloria Soto, who's at San Francisco State University in California, she and I have spent a good deal of time considering what some of these issues are and how they relate to semantic instruction. And we've spent a good deal of time kind of looking at the existing research with individuals who use AAC.